Good afternoon, and welcome to Direct Transfers for Direct Impact, a webinar from Penn Center for High Impact Philanthropy and the Center for Guaranteed Income Research. We'll be recording this webinar and sharing the video with all registrants. You can submit your questions at any time via the Q&A function. To get us started, let's define guaranteed income and cash transfers. Guaranteed income, sometimes called basic income, is a cash payment provided on a regular basis to members of a community with no strings attached and no work requirement. Similarly, a direct cash transfer may be a regular or one-time unrestricted cash payment. Now, here's our moderator, CHIP founding director, Kat Rashanda.
Thanks, Kelly, for setting us up, and thank you for joining us for a conversation I am really excited to dig into because joining us today, we have truly a leading academic expert who's pioneered work in this space, along with three funders, philanthropic funders, all practitioners who are all at different stages of incorporating direct transfers into their work and working on different issue areas in the hopes that direct transfers can amplify their impact. So I'm going to introduce them each. They'll join me in the Zoom room. You have their full bio, so we're going to go straight to the conversation. But I'm going to start by welcoming Holly Fogle, who is the founder of the Monarch Foundation and co-founder of the Bridge Project. Next, Anneliese Barron. She's the executive director of Bradley Cooper's One Family Foundation. Rashanda Perryman, who is the head of corporate philanthropy at the Vanguard Foundation, Vanguard Corporation, and she chairs the Early Childhood Funders Collaborative. And then I'm thrilled to welcome my colleague from sabbatical, Amy Castro. She's an associate professor here at our home school, the School of Social Policy and Practice, and the faculty director of the Center for Guaranteed Income Research. So Holly, Anneliese, Rashanda, Amy, so great to have you. Let's get started. So one way to understand philanthropy is that it is the use of private resources in service of the public good. For those of you who are funders, so that's Holly, Anneliese, and Rashanda, what exactly is the public good or social impact you're focused on? And how did you arrive at that focus? And we'll start with Holly.
Kat, thank you so much. And I'm delighted to be here to talk about the Bridge Project. So our idea at the Bridge Project is really simple. We put $1,000 a month into the hands of a mother, and we start during the 7th month of her pregnancy and then continue those payments through the first 1,000 days of the baby's life. So we're the country's largest cash program supporting babies with 1,100 families enrolled across all 5 boroughs of New York City and Rochester. And our goal next year is to add at least another 1,100 families across 3 more states. And as a bit of context, my husband and I are both Wharton finance majors, so return on investment really matters to us. James Heckman, the Nobel Prize winning economist out of Chicago, shows that the highest ROI was in the earliest days of life. And the academic research just keeps piling up about how important these first 1,000 days are. Everything from life expectancy to IQ points to long-term health issues to high school graduation rates. A lot of those roots can be traced back to those earliest moments of life and how stable that household is. And so I think for us, we really view that issue as just foundational to a person's whole life. And, fundamentally as a country, we are pretty terrible on this. We spend, the United States spends about $500 a year on these earliest moments as compared to countries like Chile, who you don't usually think of as real leaders in these worlds, but they spend about $8,000 a baby in these earliest moments. And that, you can only imagine then what the European countries spend, which is much, much more. So for us, the idea of preventing versus undoing harm just made logical sense. And that means babies, not after school programs to our philanthropic gains and motives. And, I think fundamentally, if we couple that with the gap that just exists in our country's funding around these earliest moments, for us, the choice to support babies was really easy.
Mm-hmm. So it's interesting the context you provided. And I guess if you thought of it, no surprise that 2 Wharton finance majors would be led by a search for ROI,
Yes.
and wind up landing on something that, as you said, is very well researched, which is the return on investment, the social return on investment, when it comes to investing in the earliest years. So thank you for that. Anneliese, the One Family Foundation, Bradley Cooper interest also came like through like personal experience and lens, but very different. Can you describe that?
Yeah, so Bradley started One Family Foundation back in 2013 after his father had passed. Bradley was a primary caregiver for his father, who had a diagnosis of lung cancer. So, he took care of him, and he just found that whole journey to be a lot harder and lonelier and challenging than he ever thought it would be, that he ever thought it would be. And he was thinking like, okay, if I'm struggling so much with the, emotional responsibilities, the, navigating the healthcare system, having to address like pain management, all those things, like, it's like, if I'm really struggling and I have the access to all the best resources to me, like if I can't do this, how are other people doing this? And he really thought about those that didn't have the luxury to just take time off of work and still be financially okay. He thought about those who have to make those dangerous economic trade-offs, like, do I put food on the table for my family or do I pay for cancer treatment? So that's why he started One Family Foundation. And the bulk of our work is helping low-income cancer patients pay for their non-medical financial needs.
Well, I think like a lot of funders, often a personal experience helps us appreciate the need for support that you might not have thought of before, right? And cancer is unfortunately a diagnosis that affects so many families. Rashanda, like Holly, you deeply committed to early childhood. You yourself, I believe, you were an early childhood educator, right? So a practitioner in that respect. And now you're heading corporate philanthropy at the Vanguard Corporation. Talk about your path to that focus area, and then maybe bring in a little bit about why direct cash transfers.
Sure. First of all, thank you so much for having me. I'm excited about this terrific conversation. So early childhood, I think it's the work that I was purposed and passionate to sort of do. I started out as an early childhood teacher, working my way through college doing that work, went to subsidy, went into public policy at the state and the national level around pre-K, and somehow landed in philanthropy. I worked at a foundation here in Philadelphia, the William Penn Foundation, at a point where they were really looking for subject matter experts. I never would have seen myself in philanthropy, but there was such a nice blend between this background that I had in early childhood and sort of putting that feet to the ground and really pushing dollars into the space itself. When I moved over to Vanguard, I think I realized pretty quickly Vanguard had already decided that they wanted to go down sort of an early childhood path. But leaders here were looking to have impact. And to Holly's point around the ROI, Vanguard knows that very well, right? And decided to go after an impact and decided on early childhood education. For me, I think, and for the staff here, as we begin to think about how do we consider strategic philanthropy, it made a lot of sense to think about where's the convergence between early childhood education and economic development, and guaranteed income really sits right there in the middle of that for us. And we've been able to really draw out a pipeline around it, and just starting out with a new cluster of guaranteed income projects that I'll tell you more about.
Fantastic. Right. So you are the accidental professional grant maker, but with a lifelong focus on early childhood. Terrific. Before I bring in Amy to really understand the evidence base that direct cash transfer sits on top of and the work that you're all doing, I wanted to follow up on some of what you shared. So Holly, you mentioned this, you and your husband, Jeff, wanting to focus on work that was preventing versus undoing. And I know in the conversations before this one, you compared it to you compared direct cash transfers to SNAP. And you told a story about like seeking scale. Could you share that with us? Because I think, there are lots of ways one can help. And I think that comparison might be useful to others.
Sure, happy to, Kat. So I'm like Rashanda, I'm a baby person first, and I think an accidental cash person secondly. So I had been working in the early childhood space up in Northern Manhattan at a organization serving mostly undocumented families. Again, in that first 1,000 days of life, I had sort of honed in on that as the core spot that I wanted to contribute back. I think what started to happen there is my husband is a venture capitalist. And so he's always pushing me, scale, scale, scale. This is very important to him. But it's really hard. I think I would say that Nido de Esperanza, this organization, does extraordinary hands-on work. But I need extraordinary bilingual social workers to do that work. And that's a hard thing to find. And so I think I really hit up against this limitation of scale for really direct service work. And of course, there's ones out there, but I think, we really, during COVID, what happened at Nido is everything got closed down, of course. New York City was on lockdown very early. And these mothers were calling us and they're saying things like, I don't have any diapers, I don't have any food, I don't have any formula. And they had no social safety net because they were mixed status households in many cases. And so that, I think, was this light bulb moment for me where we had to really hustle and we were like, we can't get this diapers into their hands fast enough. We are going to have to get cash into their hands. And we did. And I will say folks like Robinhood came alongside us and other private funders, and we raised money and we put cash in their hands. And then, this extraordinary thing happens sometime when we're good funders, we listen. And what we heard from these women is all kinds of different stories. And they really varied. Some women said, of course, they're buying diapers and formula and those things, but they were also saying things like, I need to give my landlord $200 so that we don't get kicked out onto the street, or I don't have any money to buy PPE equipment for my family. And, or I need to get a computer so my older kid can actually participate in school, or I need to keep our Wi-Fi on so that my kids can participate in school. And they're making very different decisions, but the decision that was right for their family. And I think that's where then this light bulb moment hit of actually maybe instead of all of this other work around direct service, which is good work, we might just be able to scale in terms of giving people cash. And we know, right, and Amy, I'm sure is going to talk about this, it's the most efficient and the effective tool we have out there. And there's a lot of research that backs that up. But as you were saying, Kat, we had looked at, there's a Princeton study out around different types of government support, SNAP being the most efficient. That's food stamps for those who don't know. So this helps a family buy food that's living in lower income, on a lower income, but it is valued at 80 cents on the dollar by the recipient. So if you ask this woman, what do you value this at? 80 cents on the dollar. In the underground market, if she has to sell that certificate to be able to buy diapers, which has no government support, it's valued at 65 cents on the dollar. So I have to say, I hate bureaucracy. This idea we're losing 20 to 35% of any SNAP certificate is heartbreaking to me when these families don't have that to lose. So, I think for me, it was this question of how do we do something differently? And I think that's what really sort of girded our loins, if you will, on the cash front.
The idea that it's funny, right, that we have to rediscover how efficient cash is. It feels a little bit like, shouldn't that be obvious to all of us that a lot of people's problems are because they literally do not have the cash to fix it themselves? Rashanda, so in some ways, Holly is Rashanda, Holly, and Anneliese represent a continuum of engagement with this philanthropically, where Holly described how good results and now looking to really scale. And whereas Rashanda, you and Vanguard are really now at the earlier stages of exploring it and understanding how to integrate this into your grant making. Can you talk about where you are now? And in terms of, I know you and I spoke about the not necessarily yet supporting the mothers or the parents or caregivers themselves, but seeing ways that this could help with those who help the caregivers.
Yeah, so first I'd love to just, this notion that we are rediscovering cash is like a mind blowing to me, but it's so right. And I would think, like, all of my years in the, as you said, when we started, I chair the National Early Childhood Funders Collaborative, and I think the sector as a whole is rediscovering that part of what we're trying to get at here is the fundamental issue of poverty, right? And that our work as a whole is a result of that thing. So it's just really interesting to hear it phrased like that. I appreciate that, Kat and Holly, just as a focal point. What I would say about our portfolio is that we've tried to balance in a lot of different ways. So our goal is to make sure that more young children have opportunities for high quality development opportunities, right? Like whether that's in the home, whether that's in the classroom or community environment. And certainly, how do we make sure that more public dollars are available so some of these really good projects are being funded not just by private dollars, but then are seeded by private dollars, and then public dollars then take over. So we've been doing just quite a bit of that. And we've been trying to figure out what is the right balance there, right? Because to the earlier point, right, if we over-index anywhere, then we're losing all the other pieces of the pie. And I think that's what was happening within our early childhood sector as a whole. So for us, guaranteed income offers this balance of there's real practical data around home visiting services. We know good outcomes come from that. There's real practical data about how we can teach, enable more teachers to show up in classrooms, right? Like bringing all of their knowledge and skills and ability to bear in that moment with that child. And as this research is versioning around these dollars that families can have to supplement that income, there's real practical knowledge that we can apply there as well. So for us, telling that comprehensive story, that if we're engaged in brain development with teachers, if we're engaged in brain development with parents, then this is another way that we might get to that within our portfolio. I am tremendously happy to say that we had a board meeting yesterday and our entire suite of guaranteed incomes was passed. So we are now doing sort of caregiver work around guaranteed incomes with teachers and family and child care providers, as well as with new moms.
Fantastic. Cool. Congratulations. You saw the sort of balloons and stuff that went up maybe on the
very excited. Thank you.
That's terrific. Also, I'll just take a moment now. I recognize many alumni from the High Impact Philanthropy Academy are tuning in, as well as some people who themselves have expertise in this space. And so thank you. Keep adding your comments. And also, I'll leave some open Q&A towards the end, but please submit questions and I will try to weave them into the conversation as we go. So Anneliese, you are not focused on early childhood. You are focused on health. And I know one of the things that you kept emphasizing in our prep call was this notion of cash as medicine. So can you talk to me about your work and who you're partnering with, and also what the outcomes are that you're looking to advance with direct cash transfers?
Yeah, so we're using direct cash transfers with low-income cancer patients to address financial toxicity in cancer, which is the term that is used to describe the negative impact that high medical expenses can have on patients. We all know how expensive it is to treat cancer, even with health insurance. You've got the co-payments, deductibles, medications, and most likely loss of income due to time off of work. So because of these costs, 30% of up to 30% of cancer patients delay or skip their cancer treatments altogether. And patients that have cancer are more than twice as likely to declare bankruptcy compared to individuals without cancer. And then those that do are 2.5 times more likely to die. So we can really see how finances can impact your health outcomes. Just imagine the situation where you're already dealing with the stress of a cancer diagnosis, a life-changing diagnosis. And on top of that, you're worrying how to pay for everything. And that financial strain can really force patients to make difficult decisions that compromise their treatment or deplete their savings and accumulate debt. So we recognize that the financial challenges are a big part of a patient's battle, and that's where we believe that direct cash transfers can come into play. Like you said, using cash as medicine, cash as part of that medical intervention. We believe that it will allow patients to focus on their health, to complete their treatments without that additional layer of stress, leading to better health outcomes and survival rates. So the work that we're doing right now is with UPenn. We are doing a random RCT, randomized control trial called GIFT, where we're giving patients $1,000 a month for 12 months, and we'll be evaluating their treatment adherence, treatment completion, stress markers, health outcomes, and so on and so forth, and also caregiver well-being. We all know the impact it's going to have, that, like we said, if these patients can afford essentially to focus on the treatment, they'll have better survival rates. So our partners in this, we have many, and it's great to be able to be doing work with other people. We have Independence Blue Cross, who has given us a very generous grant to basically pay for these direct cash transfers. And it's the first grant that they made out of their their Institute for Health Equity. And it's also, from my understanding, the largest grant that they've ever given. We also partner with the American Cancer Society to provide transportation and lodging for patients. And we've also partnered with the SSA. They are providing waivers for these patients so that they don't have to lose their Social Security benefits just because they're part of this trial. And then Humanity Forward Foundation, who are helping us with the benefits counseling for the patients.
Great. I mean, it's a great example of how, to Holly's point, cash is so efficient because it pays for diapers, it pays for cancer treatment, and anything else that anybody would need for their health and well-being. So we've just heard now from 3 funders who are all using this as a tool to create greater impact. I now want to find out from Amy, so what is the state of the research base behind this? There's a lot of excitement among policymakers and funders. What do we empirically know? And what is some of the noise that you're aware of that we should understand is still noise?
Yeah, great question, Kat. Thank you. At first I'd sort of like to say, just kind of to echo what so many of the philanthropists are speaking about, is that there is an intuitive nature to cash, right? So before I jump into talking about research, which obviously is important, that's why I'm a Penn professor, right? We also know there's certain things that we don't need to study in order to demonstrate impact, right? And so just to sort of set that framing up, like poverty by definition is lack of cash. Ergo, if you give people money, they're not going to be poor anymore, right? This is why the findings around the child tax credit were not earth-shattering, right? We see these big, giant policy reports coming out about lowest child poverty rate in the United States during the expansion of the child tax credit. Phenomenal, exciting, thrilling. The press were calling us and saying, "Are you surprised?" No, I'm not surprised. The sky is also blue, right? So just to say that, at the outset, sometimes we tie ourselves into knots as researchers and philanthropists, trying to come up with these really cumbersome, and I think, Holly, you were pointing to bureaucratic hurdles prior, these really cumbersome ways to make a really simple problem really complicated. Right. And that's something that we had issues with. At the same time, right, as simple as cash is, turns out giving it to people unconditionally and then also studying its impact is really, really hard. So on the face of it, the logic is pretty simple. But one of the things that makes it really difficult is the fact that our entire system in the United States, from our social contract to social services to research and philanthropy, it's set up on this model of asking people to prove that they're deserving. And what this does is it creates these layers of hurdles and administrative sort of barriers that frankly sometimes keep people mired in poverty. And sometimes we find a way out, right? But there are kind of some things that we can draw from this. Now, in terms of the research, what we know, I should also back up by saying, I believe that someone had said this at the beginning, but just in case we missed it, that, you know, the history of unconditional cash in the United States goes back to the birth of our democracy. Thomas Paine was the first one to write about it. It was the subject of Dr. King's last book. So we on this call very much stand on the shoulders of all those folks who did this work before us, in addition to a lot of the work that's been done on unconditional cash around the world, particularly in developing nations. So we're late to the game in the United States. We're on what a lot of researchers and philosophers would call the third wave of experimentation with cash. It really kind of picked up in 2014, 2015. So what we have right now is this dynamic where you know, the excitement and the policy momentum and the public conversation is moving faster than the science is, which is great, right? Like I'm like I said, like giving people cash when they're experiencing poverty, like it's intuitive, right? If you've experienced poverty or worked with folks who are living in that space, you know what it can do, right? Like you don't need me to do this really cute documentary to win you over, right? Like that's logic, okay? It is a return on investment, as Holly would say, right? But actually disentangling the ways that poverty creates trauma, the way that it creates poor mental health outcomes, the way that it creates poor health and well-being for babies, for children, for parents. I mean, the list goes on and on. So what we know right now in the United States is that we have this momentum around cash, but then at the same time, our job at the center is to help the data to catch up so that when we get to the point that we're actually, hopefully, implementing policy on a federal level or a state level, we're doing so not based on somebody's good idea, but we're doing so based on data. There's lots of reasons I could say why would we do that, but I'll hold off on that. A couple key findings that we know so far. First is that time scarcity is linked with financial scarcity. So if you can't pay your bills and you are knitting together part-time work, gig work, you don't have childcare, that creates this tremendous vacuum of time scarcity to where people literally cognitively do not have the brain space to even think about an alternative pathway. And when it comes to things like childhood development, we know the recommendations for especially kids under 5 is time. And when you have a family that's trapped in poverty, you're robbing them of time with their caregivers. Is that those two things are interlinked. They're linked in terms of the way that people engage with the employment sector and the way that they're linked with their family. Second thing that we know is that there is a tremendous amount of anxiety and depression that is tied up with income volatility. So when your money's going up and down each month where you can't predict what your finances are, it creates a tremendous amount of stress that gets inside the body. In our Stockton experiment, we showed, it was an RCT, that after 1 year of unconditional cash payments, people had moved from the category of likely to have a mild mental health disorder into the category of likely to be well, simply by providing cash. Third big finding that came out in the past 2 years, these things are kind of trickling out, was the Baby's First Years study, which I know the Bridge Project and the Vanguard Foundation's group is largely based off of their early work. So a nod to our colleagues, they're a tremendous scientist. And what they've actually established is that they saw healthier brain activity in the children whose mothers were receiving unconditional cash. The question becomes why? Why do we see these changes? And without going super into detail about it, what we know is that when you have that stress over time of not being able to make ends meet, it creates this cascade of negative health and well-being impacts that are very hard to undo. And in order to turn that clock back, what we need are not things like a one-time cash payment or an interim cash payment. You really need recurring cash over time to give people's bodies and minds and bank accounts, frankly, time to heal. I'll pause there. There's a lot more findings I could talk about, but I think that those are the ones that are the most top of mind given the audience here.
And I'll just encourage folks again to, oh, here they come. Just as I was about to say, send your questions. The questions are coming. Okay. So just to reiterate, two things that we know now from the research, the link between time scarcity and financial scarcity, and the link with just anxiety, depression, and how we respond to those situations of stress. And for, we all know, right, when you don't have the cash that you need to do what you need to do, that is a real source of stress for all of us. So one of the things that I want to come back to is this is one of the earlier comments you made, Amy, which is this has been around for a while, and yet the way it's been set up, all the systems are set up to have the potential recipient prove that they are deserving, right? And so we know it's efficient. We kind of logically know this will help. And yet there's this, but prove you deserve it. And so I would just love folks to talk about that concept. Is the beneficiary deserving of this cash? And any of you can jump in. I know you've all had experience with seeing what happens when people have to prove themselves. Maybe I'll start with I'll start with you, Anneliese. Already have a family member who has been diagnosed with cancer, or you yourself have been diagnosed with cancer, and you're not sure if you can afford your cancer treatment or your kid's next meal.
Yeah.
Talk about how that plays out.
Yeah, I mean, I think everyone is deserving of having an equal chance at surviving. So it shouldn't just be because you come from a wealthy background that you have a better chance of beating cancer. Everyone should have that same chance. If you don't have the money to even get to your cancer treatment, that's going to reduce your ability to, get better. And I think that everyone has is deserving of dignity too. When we were talking about, when I was talking to some of the patient navigators in the hospitals that we're working with, the cancer centers that we're working with, talking about this trial, this one navigator told me a story. And so this wasn't part of our trial, but it just really stuck with me. And she was telling me how, the patients that they serve are really just so often they just don't even have the money to take the train in to get their chemo. And they had a program set up. Okay, if you're working with a patient, we'll reimburse them for the transportation costs. And this one woman was like, but I can't even pay for to get the $2 or whatever up front and be reimbursed. I don't have that money. And so this patient navigator did some workaround where she was allowed to give her a train ride to and from at every appointment that she came to. So if she came to her appointment, to her chemo, she'd be like, okay, here's the tokens for your train for you to get home and for you to come back. And when you come back, you'll get your next 2 tokens. But can you just imagine how humiliating that must be to be like, okay, I'm not even going to trust you with a month's worth of transportation or 6 months or for the duration of your chemo. I'm just going to give it to you in little pieces, just like I would to a kindergartner, like, here are your raisins. Here's 2 raisins. Once you've eaten them, well, come back and I'll give you the other 2. That's kind of what it felt like to this navigator. And she couldn't even I think we can all imagine how humiliating that must be for the patient. And that's probably why a lot of them don't ask for help, because they don't have that dignity. And I believe that cash transfers gives them that dignity to be able to, do the things that they know that is going to be best for them and their families.
So that notion of it's not just efficient, but it returns dignity to people who are in a tough place financially. As you were telling that story, Anneliese, I saw Holly and Rashanda and Amy like all nodding their heads. So Holly, Rashanda, just tell us more why you were nodding your heads and if there are other examples that that resonate from the work you're doing.
I'm happy to kick off by saying, thank you for that, Anneliese, because I think it really sort of paints a real picture around, I think we've long put poor people, we've questioned integrity, right? Like, for a while, we had this sort of pull yourself up by your bootstraps, and that meant that you worked hard and did your thing. And now, and I don't know, I don't even know if it's now. It's just that if you're poor, if you're a poor person of color, particularly a Black person or a brown person in this country, if you're a woman, then you somehow lack integrity. And you might somehow use these dollars different. So it was important for me to be able to tell the story that we know how these dollars are being used, and that we actually have all the data to prove that these dollars are being used in the exact same way that every other mother uses the dollars that they have, the extra room that they have in their paycheck. And I think it's also important that we hold as a value within our philanthropy. And it took us a while to get here, that within our theory of change, we sort of categorically believe that parents and caregivers know best how to spend the money that comes into their household. And we're okay with that. I think our next sort of, thinking that we have to do, look, we're at Vanguard and we believe in financial well-being. We believe in this objective state that you're in. Can you meet your obligations? Can you weather a future storm? And can you think about your financial future with joy and hope and plan? So us trying to think to get right around, what does it mean to have more room in your paycheck? And as that more room turns into moving from poverty into actually being able to sustain, then do you have the behaviors that make it possible to sustain? And I know that's sort of a next frontier, but it's something we're thinking about, not of, connecting these dollars to sort of, financial literacy, but how might we tell a story that financial well-being is in your future? So those are some of the things that we've been dealing with. But to your question, racism and ethnocentrism and, all the other isms really play a big part in why we see beneficiaries having to prove why they would need extra cash.
I would completely back that up, Rashanda. I mean, I think you're right on it. And I mean, fundamentally, we talk a lot about trust-based philanthropy as funders. This is trust-based philanthropy, but by the way, it's trust-based philanthropy with a huge amount of research behind it that Amy and a whole bunch of others can talk to, of like, people say, they're going to spend the money on drugs and alcohol. Okay, they don't. We have lots and lots of research that shows that. They're going to quit working. Okay, our moms in the Bridge Project, their average household income is $14,700 a year. Household income in New York City with an infant. You're not going to quit working. In fact, we know that they work more. And I think in some ways that breaks my heart because, the gift of being able to stay home with your child is a gift and it's a luxury. And that's kind of crazy that in this country, that's a luxury, but it is. And then, I think this idea that you're all talking about of dignity, we just hear it back from the moms in spades of, and it's everything from the ability to provide food for your baby. We had a mom recently during the whole formula crisis that you all read about in the news a lot, where her baby needed really specific formula and she had to go to New Jersey to get it because it wasn't readily available in New York State. The minute you cross a state line, the WIC voucher, which is provided to low-income mothers, is not valid anymore. And so not only did she have to find a way to get to New Jersey to find the formula, she also now had to pay for the formula out of pocket. And she told us she uses the Bridge cash to do that. But I mean, these women are making really fundamental decisions around being able to feed their baby, and I think that's the dignity I want to give them. And I would just echo, I think also we have a 3-year time horizon. I do think that's important, this longer term time horizon. We work with Amy and CGIR, and in the beginning, they had told us that we might see people take the cash out very fast in the earliest days because they don't actually believe and trust that there is a program out there that's going to stand with them for 3 years during those entire 1,000 days of their baby's life. And so it takes a little bit of time to shift a mindset that they can think about the future and that they can take a deep breath and breathe and think about getting a GED or just getting a stroller, which enables them to be mobile around a city. The other day, a mom said to us, she used $40 to buy a Mickey Mouse birthday cake for her baby's first birthday and some decorations. And that was a huge luxury item. And she said to us, she sent us a picture of the celebration with a quote, "Today was a good day." And you think, okay, how is she making her resource trade-off? She's making really good ones because in that moment, she provided joy and a memory for her family. So, we have all this other academic research that says we can trust these people, but then this dignity that today was a good day for my family and for my baby, I think to me says it all.
I'm struck by a kind of irony in a comment that Rashanda made, which is the notion that one would need to tie cash transfers to financial literacy when what you're describing are mothers who are making really strategic financial decisions daily, like multiple times a day, in order to make the scarce resources they have go as far as possible. So thank you for those stories. Amy, I also saw you just nodding away as you were hearing. So yeah, what are you thinking?
Oh, I would just echo what, a lot of other folks had said. I think if I could underscore one thing, kind of theme across all three comments, would be kind of this, oftentimes within the research space and even in philanthropy, is that people will sometimes pit the idea of unconditional cash against asset development, or they'll pit the idea of unconditional cash against financial literacy or financial capability or financial coaching, like choose your label, right? And so one thing I want to say, that how we ended up in this place in the United States to do this work, right? Why people started to experiment is because we've been experimenting with financial literacy for 25 years in the United States. And we are at the point where we have meta-analyses, systematic reviews, hundreds and hundreds of peer-reviewed papers showing that, frankly, it doesn't do a whole lot. It might move the needle a little bit, but you can't budget your way out of poverty, right? So you can't Dave Ramsey your way out of a $14,000 a year household income in Manhattan. Like, there's no amount of like folder option or like envelope thing from, a priest or a minister telling you to do this thing that's going to get you out, right? Is that we know from financial capability research that it's about market access plus capital, right? But what ends up happening, and we know this, right? Like, we know this from research, and we even know this in some cases, in the philanthropy space, is that we're willing to talk about market access, but we're not willing to talk about capital, right? Is that we'll give people one half and not the other. So a conversation we often have with folks when they're approaching us saying, hey, I'm thinking about doing an unconditional cash program, 9 times out of 10, 3, 4, 5 questions into the meeting, what we will get is, well, what about financial literacy? Because, I saw this thing and I think these people need this. And I saw this documentary on casino stuff. And I saw this other documentary about when people win the lottery, and I'm like, we're not talking about winning the lottery here. We're talking about $500 a month or $1,000 a month. We're talking about basic stability. I just want to make it clear what it is that we're studying, is that we're studying an influx of cash, which is expected to address income inequality. We don't expect it to address the wealth gap or asset development over time, unless people were receiving that cash in duration. So I just want to put that out there. And I think when I sort of look forward to where I hope the research goes, is that we'll get to the point where we're able to, with some really strong laser precision, figure out exactly how cash works for, who it works for, how long we need the money to last to create certain types of change, how the amount of money might need to shift based on where you live, cost of living, right? And then how does that transition into other programs like asset development or, wealth accumulation? That's kind of the next frontier, but we're not there yet. And yet for some reason, we keep wanting to jump over step number 1, which is making sure that people can keep a roof over their heads. So there's more I could say about that later, but part of why people resist that is this idea of deservedness, right? Is that people are saying, you know what, if you're poor or you're experiencing poverty, you must not be working hard enough. There must be some kind of way that you have failed capitalism, rather than saying capitalism has failed you. And that is a very different way to think about it, is that we are always looking at the individual saying, well, you could have eaten better food, Anneliese. I mean, the reason that you have cancer is not because your zip code is filled with a Superfund site, but it's just because you didn't go to the gym enough. Never mind that you can't afford a gym membership, right? And so we stack these things up, and we know from research that part of the reason we do this is it makes us feel secure, right? Is that if I can look at somebody else in poverty and say, you are in that position because of poor choices you made, not because of structural conditions that produced it, it makes me feel better. It makes me feel safer. Even though most of us, unless we're independently wealthy, we feel economic risk on the daily. I mean, I've got 2 kids going to college, so it's like constant, right? But we know this, but it's too scary to look at the ways that capitalism is making us vulnerable. So instead we flip it the other direction, and we just assume that we can educate people out of it. I can give you all the education in the world, but if you're making $9 an hour and you don't have paid sick leave or paid family leave, what happens when you're diagnosed with cancer?
Yeah.
What happens when you have a child, right? You're stuck.
Well, that sort of is even more poignant the way Anneliese introduced the work of the One Family Foundation. Is it was they started along this path by someone who had all the resources and yet, you know, could appreciate how challenging it was even for him and his family. And Amy, I know you didn't see this question, or at least I don't think you did, because it literally popped up in the middle of your comments, but is related to your last remarks. And I wanted to ask if anybody else wanted to weigh in. So I love this, it's in the Q&A. I love this concept of unconditional cash transfers and find it very intuitive. But I can hear critics calling these programs un-American or socialist. How would you respond to those critics? And I welcome kind of reactions. And also, I know I think it's tied a little bit to a conversation we had about how people interpret labels, like how people hear guaranteed income. Oh, nobody should be guaranteed an income, or yeah. So un-American, socialist.
Can I jump in on that real quick, Kat, and then I'll
Yeah, go. Like I said, it's almost like you saw that question.
It's such a good question. No, I actually didn't, because I get a little distracted if I have all the things closed. I think one thing that's exciting to me, and I come to this work as a social worker first, is that I did a lot of work in community development for years and family homelessness before I, moved into the research space. And one of the things that's exciting, and I should say, like, part of the reason why we have so much momentum around cash is it's one of the only ideas I've ever seen to garner support from both the right and the left. We've had two bills introduced at the federal level trying to get a national cash experiment funded. And one was drafted by Romney, and the other was drafted by Bonnie Watson Coleman in New Jersey. And so it's one of those ideas. Now they come to it for completely different reasons, right? So the left is coming at it from a different set of assumptions and values around sort of coalescing around cash. But on the right, we do see an awful lot of support. The values are different and the things they're trying to address are different, but it is one of those things that does pull together people from both the right and the left. But to whoever asked the question, you're right, is that is sometimes the critique. But having done this work for the past 4 years, is that one of the things that I've seen is that early on, the questions that we would get and the criticisms we would get would be things like, well, aren't they going to spend it on drugs? Aren't they going to spend it on alcohol? And I'm like, maybe, I don't know. That's not my business. Right. Like, I don't ask the uber wealthy how they spend their dividends and how much they purchase. Like, why should I, to me, that just makes no sense. Right. But moving forward, those questions have largely gone away. And now we are getting into bigger questions like that, like saying, okay, if we were to do this in the United States, how do we do it in a way that's smart, that builds on the policy momentum that we already have, and asking some of those broader questions, like, how do you build a base? Is this socialist? Is it not? To me, those types of questions are an evolution in our public conversation around deservedness and around science, which I think is really exciting. Because if I was doing this webinar 3 years ago, I don't think I would have gotten that question. And it's a version of a question that we get a lot. And I think we have to stand on the fact that there is support from both the right and the left. Nixon was one of the biggest supporters in the 70s. I mean, you can take that for what it's worth. But I do find that fascinating.
Interesting. Any other comments?
I just throw out there, just sort of, in my role, I think we have to play the long game here around philanthropy and introducing our trustees and directors to trust-based philanthropy that meets our constituents at the table. And you got to start earlier than the guaranteed income conversation, in my opinion, because from my experience, the gut reaction, be it, leaders and directors who are at a table making decisions for grant making or any other institution or sector that is so indoctrinated with the way that American thought is on poverty and racism and all these other things, is that you got to start with breaking down the deep silos that we live in that constrict the way we think about people and other people in general. And for us in our philanthropy, that started 6 years ago when we started talking about who are our partners. And we moved away from our partners only being, grass tops when we begin to say that in order for us to move an agenda around young children and families, we need to be talking to families with young children. That's who drives what we do, right? So to me, if there's someone who's going to board meetings and want to move guaranteed income, I can tell you from my own experience that if you're not talking right now about the philanthropy and the fact that it is primarily driven by a notion that these are charitable causes for those other people, those Black and brown people who do not deserve our dollars, except we're going to give it to them out of the goodness of our heart, then I would say start with a look at your internal policies. Look at the way in which you are deciding who gets dollars. Who are you talking to? What does your financial processes look like, right? Like all those things, right, that you all talk about in CHIP, right? Like, but it starts before you have that guaranteed income conversation. And even when you've done that, I would say that you're going to get the same pushback, but at least then you got a little bit to, to make your case with.
Mm-hmm, mm-hmm. And, the irony in some of these strikes me because we literally started this conversation with two fellow Wharton alums. If there's no better training ground for capitalism, it's finest. So anything to add to this comment or an answer to that question, Holly?
No, I mean, I just would echo everything you all said. I think this was a journey for us. I see a question in the chat, just like it's, the question is sort of, it's new to me and my foundation, how do we think about this? I would say it was new to me as well, a few years ago. And, I think I will say cash almost works, and Amy's the expert in this, with almost any type of population you care about. So if you care about women who are suffering from domestic violence, this is a really interesting thing to explore. If you're thinking about LGBTQ homeless youth, it's a really interesting tool to explore. It goes back to what you're saying, Kat. Fundamentally, this is not mind-blowing, right? The Bridge Project won this award from Fast Company last year, and it was like, idea that can change the world. It's almost laughable when we think about it. Like, we're just giving people who don't have money, and then we're going to trust women, many Black and brown ones, as you say, Rashanda, to do what they need to do for a baby. And this is radical and groundbreaking and an idea that can change the world. I do think it can change the world. It's just a little funny to me and to Jeff, my husband, that, we have to be recognized in that way, because it's just sort of silly at the end of the day. And I think, this idea of just fundamentally providing dignity to people, we don't measure that in all the scales that Amy looks at with us, right? But I think when we think about when you believe in a woman and a mother that she is trustworthy and she knows what she needs to do, that isn't a scale we measure, but we hear those comments of, when somebody else believes in me, it gives me a little more confidence to believe in myself. And I think who knows where that goes, right? In terms of how that shows up every day in her life and as a mother, and with the patience to read a bedtime story, or the patience to take the kid to the museum, or whatever it is. But I think, these are some of the other maybe unintended or intended consequences of when, as you're saying, Rashanda, we kind of look at our better angels and believe that our fellow human being is in fact worthy, and a baby is worthy. This is not a radical way of thinking. It's sort of sad that it's a radical way of thinking. It should just be a way of thinking as a philanthropist.
Yeah. We have one practical question that I'm going to try to sneak in, and then after that, I'm going to give our panelists the last word. So 30 seconds for any last comment that you want to share with folks. And I'll go in the order that I see you, which is Anneliese, Amy, Rashanda, and then Holly. But a last practical question we're getting, which is, how does the foundation report cash gifts? Are the recipients subject to taxes on these gifts? And I'll offer that to any who want to answer it based on your experience.
Our dollars go through intermediaries, so we're funding the programs that are actually putting the dollars in the hand of individuals.
The very practical answer is, as long as you're under the threshold, the gift threshold, which is, I think, $17,000 a person right now, the recipient is not subject to tax. And so I don't think there's any program out there that's over that amount right now. So it is treated in the eyes of the IRS as a gift to a recipient.
Got it. Great. Okay.
Yeah. One thing I just want to throw out so people know, if folks have questions about this and they're moving forward, feel free to reach out to our center and we can provide some support on this. So as long as it's under the gift threshold, then you're not in IRS territory. But I'm thinking specifically of Anneliese's project, where we had to go through the Social Security Administration to try and protect disability benefits. There are sometimes ways that we need to make sure people are not losing things like a Section 8 housing voucher, Obamacare, SSDI, and there's some methods that a broader coalition have come up with to do that. So if folks have specific questions on that, please don't hesitate to reach out.
Okay. Amy, I just need to say it's a testament to your expertise that literally the question comes in as you're about to start on the answer. So there was a question about hearing about avoiding the benefits cliff. So I want to reiterate for all of you who participated today, we will follow up with links to some of the resources that have been mentioned, including a link to the website for the Center for Guaranteed Income Research, because they really are pioneering a lot of the work and working with funders to address some of the practical concerns that come up when you implement this kind of tool. But I want to wrap up and, like I said, give our panelists the last word. So I'll start with you, Anneliese. Any final comments?
Well, first of all, thank you so much for having me here today, and these amazing women that are just doing incredible work. It's just been an honor to be on this panel. I really do think that direct cash transfers has a potential to change how cancer care is done for low-income cancer patients. Like we talked about, that health equity piece. And the next step is really getting healthcare providers and insurance companies and policymakers to really understand the importance of addressing financial toxicity, in cancer. And that's why I can't stress enough how excited we are to have Independence Blue Cross Foundation as a partner in this. It's really exciting that they chose to invest in this project and follow this work with us and prove that there is that connection between cash payments and health outcomes.
Awesome. We can't wait to see the results. Amy.
Yeah, so I think, in closing, I just want to mention a couple things. So I just want to be super honest at the outset that these programs are really expensive. And we're not going to, undo hundreds of years of racism and classism through a single 12-month program, right? And so we do have to play the long game. But there are some open questions that I think for those who are in the philanthropic space probably want to ask themselves. First is dosage. So how much money creates a certain amount of change on specific domains based on cost of living? That's something we actually don't know yet. We're getting there. In particular with our partnership with the Bridge Project, I think we're going to be able to answer a lot of that. But that's a really open question, is saying how much money and for how long. That's the second piece, is how long. So the other piece I want to make sure that I mention is that duration is really important. We know that it takes a minimum of 6 months of recurring cash payments to do anything beyond relieving material hardship. So you might see changes like people being able to pay their light bill, buy diapers, things of that nature. But if you want to actually get into public health impacts, health and well-being, and some of those, goal-setting behaviors like achieving new employment or going back to school, you really need recurring cash over time. And then finally, I just want to say there's been such phenomenal momentum around place-based philanthropy in the past really 10 years. And the folks I've seen who are doing the best in this space are those who are thinking about the idea of unconditional cash on top of those places where they've already invested. So saying, hey, is there a zip code? Is there a county? Is there a neighborhood where our foundation has already invested X number of dollars over 20 years, 30 years, trying to create change? And you know that you do, let's say, tutoring really well, or you do financial capability really well. Rather than try and reinvent the wheel, ask yourselves how you can leverage cash to elevate those other programs and build on the momentum that you already have. There's lots of good examples of this. I think, everyone on the call is speaking, Anneliese's organization they know low-income cancer patients, right? And so they ask themselves the question, what would happen if we just provided these people cash? Rashanda's group knows child development, right? What would happen if we then focused on cash for not just for caregivers, but also for the people providing care? And of course, Holly's group understands babies well, right? So asking yourself the question, where have we already invested dollars either in terms of place or population? And then how can we build on that to say, hey, maybe cash can create some change in these areas, or maybe not, but you're not going to know if you don't try.
Yeah. All right. You got 30 seconds left. So Rashanda, and I'll let you, Holly, close us out before we go to a survey, one question survey to let us know how you found this webinar. Rashanda, final.
Yeah, I think Amy completely said it best, right? Like, as funders, can we build on top of the work that we're doing really well with cash assistance?
Awesome. And Holly, close us out.
Happy to. I would just echo all of that. And I would just say, you know, if I think part of this is also hope for funders that we can actually change this, that child poverty does not have to be something we all just accept as people in this country. And so I think there's a bit also of hope here for all of us to say, let's, as philanthropists, make a big push and say, we're not going to accept this anymore. And we're going to hold the government and push the government in important ways, which many folks are, which I appreciate. And if folks are interested, I would just also say I'm always happy to come talk. I have been on a long journey around this, and I'm always happy to pitch in with Amy to just help other people understand that journey. So I would just fundamentally say, let's make choices that lead to flourishing for all of us. That's the country and the world I want to live in.
It's a great final message. Hope and a call to action is what I heard from that. So thank you, all of you. It was great to have you and to get to play moderator to such a fabulous group of people. Please answer the one-word survey so we know how we're doing as a team, and I'll pass it on to Kelly for any final words.
Thank you so much to our panelists and to you, our guests. I'm going to follow up with an email that's going to have all of the resources that have been mentioned, contact information, and a video replay of this. So if you answered the one question so we can measure our impact, we'd be appreciative, and have a great afternoon.